Hello and welcome back to How We Really Feel. This is one of my solo reflective episodes, and I'm going to be reflecting on the incredible episode with Dr. Catriona and Neha Visavadia. This was a truly resonant episode, I'm sure, for lots of people. We explored so many different things when it comes to feeling dismissed, the difficulties in advocating for yourself, and what it means to find a professional that actually listens to you and believes you. I guess I'll start there. One of the things that really struck me in the episode was the impact of not being believed. Now, in my clinical practice, this is something that I see commonly. I see people who are trying to navigate the healthcare system, trying to get answers, ask intelligent, useful, important questions for their health, feeling dismissed, unheard, not supported in their quest to get understanding. And not only does this stonewall any sort of progress, gaining of understanding, scope for experimentation and trying new things, it also has a profound psychological effect. That effect is one that makes you feel incredibly vulnerable, makes you feel like you're doing the wrong thing by asking questions, by trying to get answers, can make you feel judged at the core of who you are. In this episode and in others in this season, a theme has come up time and time again of feeling like you're in the wrong, there's something wrong with you, you're overly anxious. And in a moment, we'll reflect a little bit about how that particularly seems to apply for women encountering the healthcare system. When you are made to feel like you're doing something wrong by asking questions, by trying to take an active role in your health, by working out what to do next, that vulnerability and that threat of being judged or closed down is something that naturally the brain is just averse to. It wants us to clam up and self-protect. And it's one of the most natural instincts. And we need to work with our brains where they're at, right? We don't want to push forward. We don't want to exhaust ourselves too much. And we need to take into account our capacity. But the problem is the response of the brain in this way often leads us to avoidance. And Neha talked about this in the episode, how she felt like there was no point engaging with healthcare anymore. She'd got all the answers that she needed to have in terms of you're not going to be helped. And this again is a theme that comes up that I talk about a lot in It's All in Your Body, the sense of there's nothing you can do. And when that perceived rejection, which essentially is what it is to the brain, happens, leading to avoidance, on a practical level, that closes down our opportunity for finding new information, for navigating new experiments and seeing what opens up from there. It also leaves us with this resounding sense that you will not be helped because the last time you tried, you were not helped. And it's the most natural instinct in the world to turn away when people are not helping you. The prediction is that if people didn't help you at that last time, they're never going to help you. And that increasingly feels hostile and like you're out of options. So we need to keep safely experimenting with knocking on doors to find people that will engage with us, that will support us in various different ways. And sometimes it takes time to find them, but it's so fundamental. And what I've really loved about this podcast season so far is liaising with all of these amazing professionals and people that are really committed to making a change. And the next element that needs addressing, needs acknowledgement, is the problem with medical misogyny. Dr. Catriona talked about this and reflected it really clearly. We do have a problem with medical misogyny. There is this expectation and assumption that women do and should just suffer with a higher baseline of discomfort and that that's okay and acceptable. Women are socialized to this idea. I certainly am. This sense of, oh, if you feel discomfort every time you have a period, that's just a period. If you suffer with headaches and weird pains and niggles, that's just part of being a woman and hormones. And so this socialized baseline of, yeah, you're going to hurt, you're going to find things difficult, naturally then transfers into consultations where things are going wrong more than usual. There's a sense that this is one of those things about being a woman. And the added difficulty that there is this perception that women are more anxious, this horrible word, hysterical, which has followed the gender around since, ancient Greek times. Back then it was hypothesized that the difficulty women were experiencing was because of a wandering womb that was just looking to get pregnant. And if the woman wasn't pregnant, then she was inevitably going to experience all of these ailments. We've had difficulties throughout the ages of being taken seriously and having our suffering acknowledged, but also seen as something that's worthwhile investigating and trying to change. And as long as there is that unconscious bias, as long as there is that acceptability of women having some kind of pain or discomfort, it's always going to be more difficult for women to be taken seriously when they're consulting. And there are things that we have to then engage with as women present in the healthcare system to try and advocate for ourselves. But there's also a massive role of healthcare professionals, allied healthcare professionals, and society at large to try and change some of these unconscious biases, examine when they come up for yourself, examine when they come up for colleagues, reflect back. These don't have to be confrontational experiences. They can just be acknowledgement of what's happening and how that can be unhelpful and where it might lead to. And the more we're open to examining our own unconscious bias, not just in relation to this, but other things, the more able we are to actually be helpful to our patients, be helpful to each other. The importance of doing this, I think, is never more obvious than when you really acknowledge the impact that disbelief has on a patient, on a person, the negative impacts of not being seen or heard in your suffering. We discussed this in length in the episode, which I really encourage you to go back and listen to or watch if you haven't already. Not only does feeling unseen, disbelieved lead us towards avoidance, when we've got no other choice but to try and engage again with healthcare, it can be really difficult to navigate those consultations, to feel like you're putting across what you need to put across. And physiologically, people often find that they feel muted, that thoughts go out of their brain, questions go out of their mind, that when a doctor or healthcare professional says something that doesn't actually make sense in their experience or doesn't add up to what's actually going on for you as an individual sat in front of them, it feels a momentous hurdle to flag that and say that. We have to acknowledge that there are power imbalances just by going to a professional that has a certain set of knowledge as a lay person. There's a implied power imbalance there, which as healthcare professionals and allied healthcare professionals, we should be trying to bridge and mitigate, because that can then mean that people don't ask their questions, they don't volunteer information that might be important, and then the care can't be as personalized and there might be important things that go missing. In the episode, we talked about various different ways we can prepare for appointments if we're feeling that power imbalance, if we're feeling unsure, if we're feeling hopeless about the appointment. And these were very practical things like writing down the key concerns, the key outcomes you'd like from the appointment. And importantly, not just writing it out and taking that with you, but rehearsing the words out loud. I often am talking about this with people that I work with. It is so much easier for your brain to access words and sentiments and questions when you have had the practice of saying it out loud. It's so much more accessible, and you'll be surprised what you can put into words and what you can ask when you have had that chance to practice it outside of the session coming up. It might sound silly, but it can make a huge difference. It's really important that we don't underestimate how powerful being able to regulate yourself is for these appointments. The calmer we are, the more grounded we are, the more confidence we have in what we're asking and our justified questions, the more able we are to have productive communication. And that applies even when the communication we're getting back is subpar and not as we would want. I've had experiences myself personally and vicariously with clients where staying grounded as the individual actually ends up grounding and recalibrating the healthcare professional in front of you who might have been prior to that speeding along or frustrated or impatient. It is not our job to make the healthcare professional like us, but to try and find ways that they can actually hear. And there's no better way of doing that than finding some place of grounding, calm, and having your preparation so that you don't get derailed. In the season so far, we've lots of amazing resources on the website to help prepare for appointments, including the history-taking form that Elise Day in episode 2 talked about. That's linked on the website, so do go there if you want some help. And in the meantime, if you've been enjoying the podcast, please do rate and review. It makes such a big difference for this podcast to transport to other people that might find it helpful. And we're hoping to reach a broad audience so that we can bust some taboos, we can change some status quos, and we can really help professionals also understand how important their bedside manner is to improving care. All right, take care.
Learned something today? Your brain hasn't finished with it yet. Research shows revisiting new information is all it takes for your brain to start connecting the dots on its own. So subscribe, listen again, and let it do its thing. Thanks again to our partners at Convatec Continence Care. Don't forget to check out the resources and references linked in the show notes. If you found this episode helpful, please consider rating and reviewing the podcast. It really helps to connect the podcast with those who will benefit most from it. This podcast was produced by Maya Sounds and Music.